You're going to love Suzanne Chilton just as much as you love Dr. Chris. Suzanne is a foot guru of reflexology. We're going from adhesions in the neck to down into the feet and everything in between before we're done with our 3 days today. Suzanne, thank you so much for joining us. We appreciate you making time for us.
Hi, Gina. How are you? Thank you so much for having me.
Yeah, my pleasure, my pleasure. So I don't think I shared this with you when we met before, but my understanding and what I keep saying over and over again, so correct me if I'm wrong now before I make a fool of myself for another 30 years in the industry, is that there are more nerve endings in the feet, bottoms of the feet, than there are in the whole of the back. Is this something that you know to be true?
Yes, there are over 200,000 nerve endings just in the bottom of the feet. And I would th say the hands as well too. Reflexology is done on the hands, but yes, so it's super, super powerful to be working just on the feet as a way to access the entire body.
Isn't that amazing? I've always said if somebody offered me a 10-minute chair massage, I'd rather have a 10-minute foot massage for this,
Totally.
right?
Yeah.
For real. So that's like a little insider digs. If you know the anatomy, you know that that's going to get you more benefit.
Yes,
And
totally.
I'm aware that the nerve endings in the feet are not the whole of reflexology. So without minimizing what you're here to offer, could you tell us what is, for those of us who don't know or who have heard it, I'm sure a lot of us
Yeah.
have heard about it and still don't really know, what is reflexology and how is that different to the topic I just brought up, nerve endings in the bottom of the feet? What's the difference that we need to know?
Right. So reflexology is an ancient therapy. It's been around at least 5,000 years. They have indications of it on walls and pyramids, and it's similar to traditional Chinese medicine, TCM. These ancient therapies have been around because people have recognized that they could access the body. Uh, through various other parts of the body. So the feet, the hands, we do reflexology on the feet, on the hands. We also have these microsystems on our face and actually in our ears as well. So this is a natural thing that essentially the body has created to connect us from those parts to the rest of the body. So we have essentially a map of the entire body that we can find within the feet. That's what I focus on is foot reflexology. And these are little microsystems that are representing the entire of the body. So by working just points within the feet, the hands, the ears, the face, we can actually affect change and trigger, essentially stimulate different parts of the body. So it's a really amazing way to kind of like dial down, dial into the feet, but to affect the entire body. So that's essentially what reflexology is.
That's amazing. That's incredible. And
Yeah.
I also am aware that while it's ancient, as you just reminded us, and Shoba's
Mhm.
saying that she was taught it was, 7,000 and now it's 200,000. And that's exciting, right? We're all
Yeah.
like up leveling what we know about this. So thank you, Suzanne. I also am clear that while it's ancient, it's to be officially a reflexologist, it requires official certification. And I think that's misunderstood. Um,
Yeah. Yeah, there's definitely a difference between basic foot massage and reflexology, and I always like to explain that to people. The way I work is they both feel really great, but with reflexology, we're actually targeting those reflexes in the feet that stimulate other parts of the body. So they're actually trigger points essentially. So you can kind of think of it more like acupressure, or even again in Chinese medicine, in acupuncture, those meridian lines, we're hitting those specific points. So it's definitely different than a basic massage. And yes, there is different training for that, right? We're not just manipulating the soft tissue, the muscles of the feet. We're actually working with different points. And in different types of reflexology, there's points that exist on the bones within the feet. There's points that exist within the tissues or on specific nerves. So there's varying different types of reflexology that can target these different points. And that's how we go deeper within the field of reflexology. So yeah, there is an official training for that. There is varying trainings depending on where you're located. And Europe's always pretty progressive what they do with what they do. So they have a longer training because they go into those deeper styles of reflexology. But yeah, you definitely want to see someone or learn from someone who's certified and registered. I'm with the Canadian Association to make sure that you're not just performing foot massage, which, like I said, feels good, but there's a lot more affecting the entire system, the entire body when you're doing real reflexology.
Right. How
Yeah.
long would you say it takes for a practitioner to know the difference between themselves giving a good foot massage versus actually knowing where those reflex points are?
Yeah, well, the training is usually about a year or more, but I also teach practitioners because they already have the basis in body work usually, and knowing the anatomy of the body, knowing how to work with clients with energy, with different body systems. So I actually teach practitioners how they can incorporate that into their acupuncture practice, into their naturopathic medicine, into, I've even had podiatrists that are interested because they want to go deeper, right? They don't just want to know about the anatomy of the feet. They want to learn about how is the energy and the trigger points affected in the feet. Massage therapists as well. So I've been able to teach other practitioners how to use reflexology without having to go to the lengths of a full certification. Of course, they just can't bill that they're doing reflexology, but they definitely can use the techniques within their practices to help enhance everything that they do. Because of course, when we're working on the feet and we're putting the body into a parasympathetic state, we're getting into that rest and relaxation and rejuvenation and really that healing state. It helps to amplify everything else that they're doing. So,
I love that. So
yeah.
I did a brief study of reflexology in New York when I was there training.
Hmm.
And one of the, what you're saying is so resonant, which I didn't know, which is why I'm bringing this up. I didn't realize the very strong connection that reflexology had to Eastern medicine.
Hmm.
Had all this Eastern medicine and it was just clicking and clicking and clicking while I was doing this training. And
Hmm.
then also realized, I didn't have a year at that time to do the whole certification and how reverent I was that this was involved, like super involved. It wasn't just a foot massage.
Right.
But to your point, um, I did take away a few key pieces from the training that I had, and I do use it still. I don't
Yeah.
say I'm doing reflexology, but kidney
Yeah.
one, my favorite, and you just
Yeah.
mentioned parasympathetic. So can you give us, for those of us who have Western anatomy, but we don't
Hmm.
quite have Eastern anatomy, or vice versa, we have all the Eastern anatomy. We might have even trained with you already to do some reflexology, but we're not clear on the orthopedic effect. What's the layover between kidney
Hmm.
one, from your
Hmm.
words, from kidney one, reflexology, and the rest of the structure of the body?
Hmm. Well, I find it's twofold. When I first started sharing reflexology, I had a lot of people reaching out to me about foot pain and how it could help with foot pain. And so I do find that when you're doing reflexology, when you're actually manipulating the feet, you are working on that anatomy level, right? You're loosening the tissues. You're maybe, allowing the bones, the metatarsal bones of the feet to move more. And, I'm sure a lot of people on this call have, training of anatomy lines and fascial lines and how that affects all the way up the body. So I find that reflexology is a great combination because it works on the anatomy level, but also on more of an energetic level, which is more the Eastern that you're talking about. So, that kidney one that you're talking about on my little foot thing here is right underneath the ball of the foot in the center, is the same reflex that I use, which is called the diaphragm reflex, and then also can be called the solar plexus reflex,
Mhm.
relating to, the solar plexus, that point behind the bundle of nerves behind our stomach. It's like an energy center. Also the diaphragm reflex, so right underneath there, right in the center, which helps us, with our breathing. So I like to use and sort of combine both, because when we are working on the feet, we are relaxing the fascia, we are affecting up the line, and of course, the way that your feet are aligned affect your knees, your hips, everything up the line. So I find it does help with that too, because we are actually manipulating things. But on the other side, we're actually like releasing blockages in those energetic lines that Eastern medicine points to, the meridian lines, and we're allowing for a clear channel of energy to flow. And when we
Mhm.
do that, We're doing what the body wants to do. We want to have that clear line. When we unlock the solar plexus in yoga, we're creating a clear channel up and down the chakras. It's the same thing unlocking the diaphragm reflex or kidney one in acupuncture. So I like that it's kind of connected to both the
Yeah.
anatomy side and the energetic side, because I think as we're learning more and more, you can't just separate the two, right? It's all connected, especially as they're learning more about fascia and it being like this quantum network of communication, up and down the body. I just find it fascinating that you can kind of pull in and utilize, from a bunch of different therapies. So I do find that reflexology is both helpful in that uh, more anatomy way of releasing the feet, and it definitely helps with foot pain, but also we're creating positive change in other organs, body systems, and parts of the body. So I think it really is a nice connection between both.
I love this. And I'm
Mm.
sorry to giggled when you first started because I asked the question sincerely. Your foot model was so realistic that
I
it took me
know.
a second. And then the
You thought,
chat,
is it me? Is it my foot I'm putting up?
yes, and HP put in a note. She's like, I thought she was super flexible for a second. Everybody starts commenting on the laughing. I was kind of laughing too, especially because your
Yeah,
background's just a little bit. Yeah, looks like you put your foot up on the camera.
I know. This is Tootsie. Her name's Tootsie.
So good. She's very realistic, Tootsie.
She is. I used to have a crappier one. I had like, I could only find, at Halloween, they have those severed feet. So I literally had one of those with like a sock over the top that was severed. And that's what I used to use. But this one's actually like pliable and really, really nice to use. So
Amazing. She's very Tootsie, you made your mark on camera
made
today.
her appearance. Yeah.
That was so good. I recognize what you're saying, just getting back to the answer that you offered us. I recognize what you're saying because as I do body work, and I'm working on, chronic pain and big type of issues,
Hmm.
when I have a patient on the table and I'm able to get to kidney one first, it gives me so much access all the way up right to the sacrum that I
Hmm.
don't think I would be able to have as quickly without.
Hmm.
And a couple times I've worked kidney one and working, you just hold it. That's what I was taught. You just hold it. And the
Hmm.
body, the legs are doing like involuntary. And I thought, oh, wasn't that interesting? Look at all that's in there that's either
Hmm.
recalibrating or coming out, or I don't know sure which direction it's going, but it's definitely creating a positive
Totally.
effect. And I just really love that.
Totally. I love that too. That's what I love about reflexology is we're really just tapping into the body's innate wisdom, and
Mhm.
allowing unblocking things so that it can do what it needs to do. And I'm sure everyone here who works in different capacities with the body understands that, right? The more you work in a certain therapy, the more you realize that you don't need to do, like you're not forcing yourself on your client or your patient, trying to affect change. Sometimes even just a few key things can create the most change because the body knows what it's supposed to do to, come back to harmony, come back to homeostasis. So I do love that about reflexology is it's kind of like a little something that can amp up everything else that you're doing.
Yeah, absolutely. And you called it too. We say that even in the method that I train in, um, you don't have to hang the moon. It's amazing. You just give the body a little bit of guidance and direction and support, and it'll take care of it.
Mm-hmm.
You don't have to be like overdoing as a provider. If you're overdoing, thinking that you're creating, you might just be, drowning their nervous system in
Oh, totally.
impulses. Less
Totally.
is more.
Totally. And that's the way that I teach reflexology, the way that I sort of the methods that I've come up with over almost a decade of working on people's feet is that less is more. Also because as you're saying, you can affect a lot of change if you're specific about what you're working on and the
Mhm.
body knows. And also just from a practitioner standpoint, it helps for burnout. You're not working and digging really hard. That's what some people come to me ask about, does reflexology, am I going to burn out my fingers and my hands? And some styles are like that. Some styles are really deep tissues. Some styles even use a stick, more like Thai reflexology uses a stick to really find points. But the way that I like to work is a lot more gentle, a lot more intuitive, a lot more energetic, connecting with the body. And as you said, just allowing it to be in that healing state.
Absolutely. So there's a
Yeah.
couple of questions that came in. I'll
Uh,
get to them all. Sylvia, I'm going to go with yours first because Sylvia says, what if you do a foot massage and you're not a reflexologist, can you create an adverse reaction? I'm paraphrasing the question. And I
mhm,
recognize the basis of this question, especially being trained in Eastern anatomy. We're taught, don't push this point, don't push that point. If they're pregnant, you could create,
mhm.
induce labor, et cetera. Can you do that not knowing if you're doing a lot of foot massage?
When you're doing foot massage, again, like I said, because you're not really necessarily accessing those reflex points and pressing into them, if it's more just light touch massage, I think it's probably okay. And yes, there are contraindications for sure when you're doing reflexology. As you mentioned, there are certain points that we don't want to press during pregnancy because in some women it can trigger labor. So there's a few points that are contraindicated, which is why it is important if you are going to dive deeper into the feet and do that reflexology to have a bit of training around that, because yes, it can be very powerful. I think if you're just doing, if you're a massage therapist and you're just continuing down onto the feet, in general, I don't think there's any harm in that because, as I mentioned, you're not as aware of specific points that you might be pressing into, triggering different systems of the body. But yes, if you're definitely going to do more than that, I think it's important to have some training around how to do it safely and how to do it effectively, and to recognize when your client or patient their nervous system may be in a situation where they don't want anymore. Um, we do look for and recognize different, sweating in the feet and stuff like that to give us an indication as to whether the body wants it or not. So I think it is
Mhm.
important.
Always listen to the body.
Hmm.
Yeah, definitely
Hmm.
renegade in the space. So Gary has a two-part question. Why do
Hmm.
reflexology charts differ so much?
Hmm.
And what's the difference in technique? How do you know? And that might not be something you can answer here. It might be more of like get the training, but what is the
Hmm.
difference in, static holds versus creating movement when you're administering reflexology?
Hmm. So firstly about the charts. So yes, there are different charts based on how different cultures have seen the feet. So there are
Mhm.
variations in foot charts across those different cultures. And I liken that to, I've had people ask me this question before. I feel like all of them are valid because, first of all, everybody's anatomy is slightly different. And so, say if I'm trying to locate the kidney reflex or the diaphragm reflex in a person and it doesn't feel like it's the right spot, I'm not feeling what I usually feel in that area to indicate that reflex, it can be slightly offset, it can be slightly different. The same thing with different cultures, as you pointed out, kidney one is also diaphragm, which is also solar plexus, depending on which chart you're looking at. So I do believe they're all valid, and they can all overlap, depending on, because meridians do overlap different reflex points in the body. So I
Right.
do feel like they're all valid. I think it's important to get a proper foot map. And I am sharing one as my extra gift today.
Yay.
My Foot Guru foot map that I created, I lovingly created. It took me a long time to create it to make sure that it not only looked nice, but it was really easy to read and really easy to locate. So I'm excited to share that with everyone just so they can start discovering some reflexes on their clients' feet. Maybe if something, say they are working on the digestive system, digestive issues with their client, they can actually work a little bit on those reflexes too, that sort of thing. And then the second part of your question, what was it again?
Yeah, Gary asked about, how do you know long hold versus movement? What is that?
Right. So
What's the
that
difference?
is something that you learn when you do learn reflexology techniques, when to use a sliding technique, when to use more of a hold or a digging in technique, or what we call thumb or finger walking. So that does change based on how the reflex feels or what you're trying to create in the client, the change you're trying to create. So for example, just to talk generally about it, when we are trying to, say, speed up the digestive system because a client has a lot of constipation, that sort of thing, we're going to work in a faster way to try to give energy to that area and get things moving more. On the flip side, if a client has diarrhea, too much digestive inflammation, we're going to work in a slower fashion to try to release inflammation and calm that area. So yeah.
Mhm.
Hmm.
Sense. Yep. And of course, that would be part of the training. It is a year long. We did say Chantel dropped your foot
Yes.
guru map. Thank you so much for doing that, Chantel. Did Tootsie help you create that map, Suzanne?
Um, did she help me create it? You know what? Canva helped me create it.
Keeping it real.
Um, yeah, it's like I said, it's based on the map that I learned, which is actually different than the Canadian map. I actually learned my teacher that I learned from, she actually learned from a German teacher. So her name's Hannah Marquardt, and she actually just passed away. She was 90. She was over in Germany and a very, very prolific reflexology teacher. And so I learned from her map, and that's what I use. And I based my map off of that as well.
Great.
Yeah.
Amazing. We have
Yeah.
another really interesting question. Mahudmita says, what about in circumstances like neuropathy, like diabetes? Does the
Mm.
reflexology still create that reflex and the benefit if the nervous system, I'm paraphrasing your question, I hope that's all right. If the
Mhm.
nervous system isn't intact to that area of the body, does the reflexology still create positive effect?
Yes, I have worked with a lot of clients with neuropathy, sometimes diabetes, but actually I've worked with a lot of cancer patients, which with different chemotherapies can create neuropathy in the hands and the feet. And first of all, what's really good about reflexology is it creates a lot of extra circulation in the feet. So just from that basic level, especially clients that are diabetic as well, it really helps to draw that new fresh blood down there and create healing for those nerves that might be damaged. So I work in a very gentle way with people with neuropathy, but I do find that they do feel better afterward. They feel more sensation, and they feel less, say, less cold in their feet. The temperature has increased. So just that extra circulation down there, working on different points. Yes, it still does affect their body. Because even if we have certain nerves that are damaged, the body knows how to reroute itself, to still affect. Even if we're working on, I've had people ask, my client doesn't have one foot. Can we still do the reflexology and still have an effect? Yes, because or they don't have an organ anymore. They've had, their gallbladder removed, but energetically there's still that organ there. So it still has the capacity to trigger the rest of the body. So yes, it does really work with people with neuropathy. It's very helpful. It helps soothe their feet. Um, and it does help bring relief to the pain, the tingling, the numbness that they have.
Okay, awesome. Hey guys, I see you in the chat looking for the map, and we might not have the right link. We might
Oh,
have the right link. I can't quite tell what that is.
let me.
But yeah, but Suzanne will get you the map. We will get the map of Tootsie. Don't you fret. Thanks for letting us know if that link didn't open. I'm sure if I know Chantel well, she's probably clicking like a madwoman back there trying to figure it out. So
It
we
should be
Okay,
just.
so you're for the map link, it's opening up to your training, not the map.
Oh,
Yeah, we'll figure it out. Don't
I
fret it.
just uh, I just did it, and it does come up to. Oh no, you're right. Yes, it is going to the training, so we need the other link.
Do you happen to have it with you, Suzanne? If not, we can come back later and get it from you.
Yes, let me grab it. Just give me one moment
All
here.
right. See, this is real-time TV, guys. This is how it happens. This is not edited. This is not pre-recorded. You're getting it in real time.
There we
We're going to
go.
ask just another question too. I have a question for you. Can I ask a question while you're clicking around on tech, or do you need a second?
Sure. Yeah, one sec here. Let me see if this works.
Yeah, let me not have
I
to
want to
focus
be able to focus.
on more than one thing at a time. I like the comment about the energy, that the energy is still there, right? We know this
Yes.
in the human body when we have surgery and things. Lori says
Yeah.
gratitude, her ahas are that the body knows what it needs to do, always to come
Yeah.
back to balance, less is more, connect with the body and let it be in the healing state. Super love this. Thanks, Lori, for those training tidbits, highlights, takeaways, and ahas.
Mm-hmm.
What do
Yeah,
you
so
think?
the original link there, oh, sorry, I'll just say the original link there is a link to my free training. So it is for wellness practitioners, body workers that are interested in, as I mentioned, learning how to enhance their practice and their client results with reflexology, but not have to take a full certification
Okay.
because you're adding it on to your current sessions. So
Mhm.
that's that one. And then I just posted the second link. This should work. It should go to a pop-up if someone can try that out. For the foot map as well. Make sure that
Awesome. Where did
works.
you post that, darling? Did you put it in our chat here?
I
Where
did,
did you,
right above Lori.
right above Lori? Isn't that interesting? It's not showing for me.
Not showing up. Weird.
Not in my chat. Is anybody else seeing the
Oh,
map?
maybe it's going straight to Chantel
Yeah.
somehow.
Do the blue button above where you posted it. Do the
Ah,
drop down on that. You might have sent it to Chantal. Just
oh,
do the everyone.
everyone.
It's
There we
Pia
go.
and Sheila and Alex and Lisa. It's coming. It's
There we
coming.
go. There we
Ah!
go. I did it to everyone. There we
You and
go.
Chantal posted at the same time. We got it. We got the Tootsie map. We got the Tootsie map. Thank you. Okay, everybody, grab that link. Thanks,
Grab
Suzanne.
that link while it's hot.
Yeah, thanks for putting that in there for us. We appreciate it. Clearly, it's a hot one. Everybody is eager for it. So thank you for giving us such a beautiful gift. Everybody's excited. I'm going to
Yeah.
grab it too and look. I have one more question for you, if you don't mind, before we
Mhm.
let you go.
Of
What
course.
happens? What happens for? Thank you, Chantal, for reflexology in the instance when there are orthopedic restrictions in a foot, like bunions or hammer toes or, other types of orthopedic restrictions. What happens then? Is it the same idea? The energy still flows, or is there a need for maybe more training because those energy flow
Mhm.
states are interrupted?
Mhm. I do, again, this kind of goes back to my that I mentioned about reflexology being helpful for foot pain. Because personally, when I work on clients, if they do say have hammer toes or a bunion, I'm going to work a little bit differently. With hammer toes specifically, I am going to work to try to release the toes. So I'm going to do a little bit more movement, a little bit more, if I can sort of show here, a little bit more pulling and rotating the
Mhm.
toes just to kind of, because yes, we want to create more movement. The more movement, the more the channels are going to open up for the energy, and the more we're going to be able to communicate with the rest of the body. Specifically with someone with a bunion, I do work very gently over a bunion. I don't press hard on a bunion. I don't want to create more issues, but I do work a lot on the reflexes here, which is for the neck. And coincidentally, when people have bunions, they usually have a lot of issues in their neck and their upper spine because of it being right on that reflex. So it does affect, right? So when clients have different issues in their feet, I do tend to work a little bit differently and adjust to what they have going on. And yeah, if they have really thick, say, skin that's built up on the bottom of their feet too, I may have to work a little bit harder to try to get in there and affect the reflex for sure. It does cause a little bit of resistance. So yeah, that's adjusted depending on what the person is dealing with. But the idea is the same. And the more you work on the feet, the more they're going to loosen up and become more supple. And the other thing about reflexology is the more you do it, the more you practice it on someone's feet, the more the body understands that communication. I usually say to clients when I first start seeing them, give it 2 to 3 sessions to let your body really start to understand what's going on. Um,
Mhm.
that communication that's going on. But over time it does, and it gets more and more effective at communicating. So I
Yeah.
think if you do have clients that have foot restrictions, it can be still important to work on them because you are going to get that twofold benefit. You're going to get like the loosening of the feet, the more circulation down there, the releasing of the inflammation, but then you're also going to get those positive effects, those benefits on the rest of the body.
Mhm. Love that. Oh my gosh, I could talk to you for another 10 minutes. There's like 5 things I wanted to say, but my Schatz Method practitioner crew, I hope you guys recognize the whisper of footwork that we do that Suzanne was talking about. When there's orthopedic restrictions, we still need to get those out of the way for the energy to flow. And
Hmm.
also what you just shared with us, Suzanne, about the area on the foot that's connected to the neck that happens to coincide symptomatically with someone who's moving through the world with bunions. When I
Hmm.
did that in reflexology, it was one of those, holy smoke, it is all connected. The
Hmm.
whole, the whole shebang.
Mhm.
one magical playground. There is no isolation and separateness. It's so
Totally.
gorgeous. It's so beautiful.
Totally.
Yeah, I love
Yeah.
this. Thank you so much for pouring into us today. I really appreciate you.
Oh, no,
Clearly,
thank you for having me.
yeah, of course. Clearly, there's more for us to learn from you.